will be cared for through charity.
Through what?
Through charity.
Yeah. Okay, so that's about, what I'm talking about, and there's so many people dependent on medical care. I deal with that in the budget, and I also qualify when I announce that I want to cut all the spending, but I want to preserve some programs. I would have priorities, the elderly, medical care, care for the children. That doesn't mean that I thought it was a great idea, because this is why we're in a mess. Because Social Security has no money in the bank. So it's really going to take a lot of work, cutting and working our way out of this. Now, when I got out of medical school in 1961, I practiced for a couple of years before there was Medicaid. I worked in a Catholic hospital and didn't make hardly any money. Nobody was turned away, and people were treated. And back in those days, people weren't laying in the street with no medical care. Doctors always charged the least. Now, with the government coming in with these programs that aren't, they're totally bankrupt, everybody charges the most. Everybody from the doctors to the labs to the hospitals. In Texas, you have a lot of illegal aliens come in. They have a baby. The babies immediately are put on the welfare rolls, and the parents then qualify. And because the hospitals need the money, because the costs are going up, it's just a real mess. And as far as I'm concerned, it's been created by the government. So I would try to work out of this, but I would want to transition. So some of you, if you see, this is not the way. I don't want to be totally dependent on the government. I want to really promote these medical savings accounts so people can, put their money aside and get it off their taxes and buy their own insurance and pay cash to the doctor. You need to get that doctor-patient relationship back again. But it is a problem because there is a dependency. But as the economy gets worse, that gets worse. If you took this food stamp issue, it wasn't too long ago I was using the number, well, there's 40 million people on food stamps now. And then later on I said, oh, no, somebody said it's 44. Last week I said, no, it's 46. So what we have created is a catch-22. The worse things get, and the more you need to spend, whether it's medical care or food stamps or whatever, and our country gets poorer. Our jobs are gone. We can't raise taxes. So the only thing is back to printing the money and borrowing the money. But it's not going to last. But I'm convinced we can do it, and we could work it our way. But I'm not overly confident in the way we're going. But I think the calamity is if we care about anybody, we have to avoid this major crisis where 2008 is going to look rather minor. And I think that's what we're moving toward. That's why in the world can't we agree on at least change our attitude about spending all this money overseas and try to take care of some of these problems at home?
So how will these children get care? 43% of children.
You mean when? Right now, this minute?
Well, when
you mean if you had
like to?
Okay, I said I described up to having a transition, and they would be taking care of those funds in my budget. Takes care of them, so they're going to get care. But you're talking about when we have a free society once again, how's it going to be taken care of? Well, why don't we look before how the country survived before 1965? Maybe we cost them that. Not that long ago. I worked for $3 an hour. When I got in my medical practice, my office call was $5 an hour. But now you pay more than that, don't you? You go to see a doctor. I didn't say you pay quite that much in park or something like that. But the cost goes up because the government's involved. When you destroy the value of money, prices go up more in the areas that the government gets involved in. They're very much involved in housing. Prices exploded, had to be a correction. They're very much involved in education. What has happened to the cost of education? Does the quality go up? No, the price skyrockets. Young people can't pay it, so we give them easy loans, so they graduate with $1 trillion worth of debt and no jobs. In medicine, it's very similar. The price goes up, and it's very difficult for it to happen. For people to make this, I know of the problem, but we have these legal problems where doctors over-order because of litigation. That's part of the problem, but it's really inflation and doing away with competition. We need more competition in medicine. The people when you have these medical programs, always wanting to help people, humanitarian instincts. So whether it's a Republican program for prescription health program, guess who does the lobbying? The drug companies and insurance companies. They run the show. So we get Obamacare. Who do you think came and lobbied? The drug company? So I am convinced, because I'm sure you have sincere humanitarian instincts, and your question reveals this. You want, how are we going to take care of people? But what I have come to the conclusion after studying free market Austrian economics, being in medicine, being in politics, if you're a humanitarian, you want to care about people, you better free up the systems that believe and understand how freedom works and sound money works, and how limited government will provide a lot more for people than doing it through the government. When a country destroys its currency, one of the characteristics is you wipe out the middle class. Money goes from the middle class to the wealthy. It's happening today. The middle class is getting smaller. The Wall Streeters are still getting their bailouts, and they have all the advantages of the monetary system because they get the money first. When they get the money, they have the value, they spend it and circulate it, and prices go up, and then you can't afford medical care. So I believe that one of the shortcomings of libertarianism and conservatism is we've never really expressed ourselves on this very point because it sounds like, oh, you're cold-hearted, you don't care about people, the government's not going to take care of us. But who is the government? You know, if somebody here wants the government to take care of them, you're the government. You know, somebody has to go and shuffle the cards. But this is the wonderful thing about America. We've had the best experiment ever in the history of the world. The freest of markets, the largest middle class ever, the greatest prosperity. It's going down the tubes. If we're going to witness the disintegration of it if we don't do something about it real soon.